Hello, hopeful YouTube fans. Welcome back. Today, you're probably wondering why on earth we are sharing a video that we took nearly 4 years ago. Well, there's good reason for that. This video you're about to see was filmed February 20th, 2020 at Congressman Dan Crenshaw's second annual Healthcare Innovation Summit. I was invited to talk about what we were up to, the research we're doing, and also since we're a clinical stage biotechnology company, we were also asked to bring a patient who could share their story about the whole clinical trial experience. So when you get to the end of the video, you're going to meet one of these patients who was actually the very first patient with Parkinson's disease that we ever treated. For those of you who've been to our channel, you will see that we do not post patient testimonials. If you go onto YouTube and you do a quick search on stem cells, you will see that there is no shortage of patient stories and testimonials from regular people to celebrities to athletes going all over the place to get cells. And a lot of it is fairly anecdotal, meaning it's a good story, but doesn't really have any data to back it up. The problem with these stories is that it can often mislead or prey on very vulnerable populations. So we're very careful when we post any kind of patient experience or story. With that being said, if you click on the link below, on the caption below, you're going to actually find a link to a paper, which is a compilation of 3 to 4 years worth of work that we had with this patient. The evidence for what happened to this patient is carefully documented and peer-reviewed in the publication below. Please take the time to read it. And when you read it, along with watching the video, we think you will be as excited as we've been and understand why we have gone in completely invested in the field of Parkinson's research. We think that through this one patient's story, it's brought a lot of hope into the field, and we think you're going to really enjoy the story. So please watch to the end. Don't forget to subscribe. We do have a clinical trial for Parkinson's disease currently enrolling. We still are looking for patients for that. We're going to link that below. All of the research now conducted in Parkinson's is done through the Hope Biosciences Research Foundation, which their YouTube channel is also linked below. So please subscribe, follow us, and enjoy the rest of the video.
Donna Chang, please join us on the stage. Please give her a round of applause. Hi, great to see you. Thanks for being with us. So I'll introduce you real quick here. You're the president and CEO of Hope Biosciences. That's a biotechnology company that develops stem cell-based therapies for chronic degenerative diseases like Alzheimer's, among others. So I'll just let you take it from there. How did you start this? And tell everybody what stem cells are. Let's not assume that everybody here is an expert.
Okay, biology 101. Stem cells are essentially cells that have no identity. Imagine a baby that could become anything when they grow up. Stem cells are that. All of us have come from stem cells. Every single one of the cells that make up our bodies, from our skin to our hair to our bones to our teeth, all came from a stem cell. So with that, there are lots of stem cells that do a lot of things, but I think when I say that I'm in stem cell research, people are either pretty jaded or skeptical most of the time, because there just hasn't been, there's a lot of work being done in stem cells, but there just hasn't been any kind of breakthrough innovation.
And there's a lot of rumors. Everybody keeps hearing stem cells are the next big breakthrough. Well, we can regrow an eye. Not that anybody cares about that, but but these are the kind of things you hear about, and you're like, all right, well, when are we going to do that? Well, so what are the obstacles? Why can't we grow my eye back?
Well, there is no question that stem cells have a lot of potential. None at all, right? People There are more papers written about particularly mesenchymal stem cells over the course of the past 10 years than pretty much any other cell type. So we do know that there is so much potential. And I can tell you in a lab, we can make mice do anything. Okay, we take traumatic brain injury, we blow half of their brains out, and they can live perfectly great lives in their cage. But does that equate to a human being going back to work? That's where our limitations are. And the limitations are actually due to these three things. Number one, we have a really hard time finding the right stem cell to fix the right problem. We're often targeting the wrong cell type when it comes to trying to fix the problem that we want. Let's say you find the right cell type, some stem cell, to actually fix the problem. Then you need enough of them to fix the problem. The quantity is the problem. So how are you going to generate enough cells to create a therapeutic advantage? Number three, this is the real problem in cell therapy. And if anyone figures this out, it's which we have. But yeah, okay. So the third problem is repeatability. Think about disease, right? Alzheimer's, for example. We do not wake up one day and just have Alzheimer's disease. It's a chronic degenerative process, probably happening 20 to 30 years before you see your first symptom. So how are you going to regenerate sort of in the same way you've degenerated? You have to do it repeatedly. You have to repeat treatments until you fix the problem. Well, when you talk about repeated cell therapies, typically with foreign cells, you're talking about introducing foreign cells constantly into your body. That's a safety problem, right? So we have a lot of things that we need to overcome, and these three things you have to overcome in order to have any kind of promising, fixing disease, that becomes the easy part if you can solve these three.
And you're on your way to solving these three.
Well, we have, so it's all done. Okay, so I'm going to just fast forward here.
I want to get to a really cool story about that in a second. First, I want to ask, because we do have a little bit more time with you. I'm always trying to squeeze more information in as much as possible. Because a question I have, because I hear from this from my old colleagues a lot, the SEAL teams, because we've got a lot of joint problems and everybody's got a bad back and a bad shoulder, and they keep saying that they do stem cell injections, and that all of a sudden their problems are practically going away. Mm-hmm. So can you talk about that for a second before we get to the really major breakthrough that you guys have had?
Okay. So if you have been living in Houston and pretty much anywhere in the United States, you have now listened to the radio, and I see infomercials now. I mean, they're getting pretty sophisticated. You hear about stem cell everything. There are even stem cell like vitamins. Apparently you can grow stem cells by taking vitamins. Anyway, all of this stuff that you're hearing, and patients, and you hear countless patients coming out telling their stories. What scientists like to say is anecdotal evidence. When a patient says, I got joint injections, I was a Navy SEAL or a football player, and I got stem cells and I feel great, I believe it. I don't think they're making that up. But the problem is that these therapies are being administered sort of on, at least the ones that are available in the United States are same-day treatments. That's what's happening, right? They're taking some source of stem cells somewhere, whether umbilical cord or whatever it is. They'll spin it down, give it right back to you. So what you're getting are very small amounts of cells, very, very small. That's why some patients it works wonderfully, and then you have a bunch of patients that say, oh, it was a rip-off, it didn't work. I see. So it's across the board, right? And the problem is because of the consistency of the cell. Not everyone's getting the same product. Yes, that's the problem. And so the people who are getting some cells might see some benefit. So I do think that even at a small dosage, you can see some benefit. That's
good to know before you go buying stem cells.
Okay.
So it's one thing to fix some joint pain, but it's quite another to fix somebody with a true spinal cord injury. So tell us about that.
Well, so we have to go back to the problem, right? Which is, how are you going to get enough quantity of cells? So we have to target, can we make enough cells for every single person? If we had to do it, every single person in this room, we have to be able to do it for everyone. Otherwise, you don't have a viable cell therapy. So first we said, okay, can we make a lot of cells? So this is what you will typically see in a stem cell lab across the med center. Anywhere you go, you seed 1 million MSCs, and after 5 days, you'll end up with, like on the right side, 1.5 million MSCs. You don't have to be a stem cell scientist to know that this is kind of typical for what you would see in growing stem cells. If I were to tell you that an efficacious dose of cells would require at least 200 million cells, it's going to take a long time to get there. This is why cell therapies, gene therapies are so expensive, right? Because it takes so much time. So next slide. We can generate in 5 days 32 million cells from seeding 1 million cells. Same amount of cells seeded, and we can do this very quickly, meaning efficiently, cost effectively. Traditional 2D cell culture. 2D cell culture is super cheap. Okay,
Yeah.
We're talking about basic technology, but being able to deliver a high quality product. How do we do this from every single person? We start with a tablespoon of fat. From a single tablespoon of fat, we generate all the MSCs we need. We grow them in the lab, just like I showed you in that slide. But the beauty of this is from one fat extraction, we can generate over 1,037 therapies throughout your whole life.
Wow.
So you bank once, and you'll have enough therapies for life. Currently in clinic, we have a lot of clinical trials, and we have 8 currently active clinical trials in progress, and we work with lots of brilliant people here in the Med Center to run these clinical trials, and there are real human beings getting real cells, so that's currently happening.
And don't we have one of your patients here?
Well, we do. So I will introduce her, but to give you a little bit of background, when I talked about the example of Alzheimer's disease or Parkinson's, any chronic degenerative disease, you have to think about how many cells and how many treatments is it going to take to get someone well. We are treating spinal cord injury actively. Mm-hmm. We do a lot of traumatic brain injury, by the way. I heard that in DC we have a TBI problem with some of the Iran things that happened. Just letting you know, you can take that back to them. But in spinal cord
I thought
injury,
you meant Congress people just acting crazy.
That too. I don't know if I can. I don't think there's any number of cells that can help that problem.
No, it's true.
So we have a spinal cord injury patient, for example, quadriplegic, a young father of 2, and people ask me, is it possible that spinal cord injury patients can walk again? Mm-hmm. And before you would say, oh, well, we can get dogs to do it. Why couldn't we get humans to do it? But it's always been a limitation. Without that limit now, absolutely, I think it's possible. Why isn't it? We had FDA clearance to give this patient 10 infusions over the course of 6 months. And just last week, he drove his car, this quadriplegic drove his car from Dallas to Houston. So do I think it's possible? Yes. Ask me after the 500th treatment, and I'll tell you how it went, right? Parkinson's disease, same kind of thing, chronic degenerative disease. We asked for FDA for a compassionate use exemption for a patient who had Parkinson's for 14 years. Her name is Dr. Injir Tan. She suffered from Parkinson's for 14 years, severely debilitated, on toxic levels of medication that would create hypermovements. So thankfully, FDA cleared 8, an unprecedented amount of treatments for this patient, 8 treatments. That's a total of 1.6 billion cells. This is safe because it's her own cells, right? Yeah. So she began receiving treatments. She has received 7 out of 8 treatments already. And I think she has made some dramatic improvements. And she is actually here today. Yeah, she's actually here today.
Maybe we could have her come
up. And so maybe if she's up for it, if she wants to come up. She's coming up by herself. Oh my God.
Yeah. Incredible. Welcome, Lucy. And maybe just briefly, you'd like to talk about your story.
Would you like to say anything?
Well, I'm a volunteer And I hope they started through me. I think I'm the only one who completed almost one more infusion I have. And I'm of course hoping that I see brighter days, and all the other Parkinson patients and others benefit from this research. Thank you very much.
Incredible. Donna, thank you so much. It's amazing work. Thank you for
everyone.
showcasing this today. Absolutely incredible.